Hi, guys, I hope you all are doing well. As you all know, cancer is one of the common diseases as well as thousands of deaths happen in the world every year due to cancer. So we are going to talk about 10 things to do if you are at the first stage of cancer. Number 10. Find a good doctor. Find the best doctor available. This may require extreme decision-making and most of your time. Choosing the best one in your area, planning out your budget. Choose the correct doctor who thoroughly specializes in cancer treatment. These are all essential for a cancer patient's recovery program. A good place to check is the 63 cancer centers that the National Cancer Institute recognizes for scientific excellence and the capability to integrate a diversity of research approaches. Some of the things that you need to look in a cancer center includes a low mortality index, meaning the least amount of deaths in that particular cancer center, a high ratio of nurses to patients, which means the number of patients should be lower than the number of nurses, and an opportunity to participate in clinical trials. Number 9. Keep emotionally stable. As time passes, your loved ones and you will start adjusting to the cancer diagnosis. This time is very important, as it is a time of change and action. Everyone around you is getting used to all that is happening. Number 8. Be sure to know about new medicines. If you get a prescription for a new drug, be sure to know its name, what it does, what's it for, and why you are getting it. Some other questions you need to ask yourself are how and when the medicine should be taken. What's the prescribed dose? Should it be consumed with food or water, or without? Are there any side effects like loss of sleep, nausea, or a dry mouth? When should you expect it to initiate its effects on you? Will it collide or interfere with any other medicine that you're taking? Should you take this individually? Avoid any kind of food, medicine, or vitamins when taking this, or is it okay to take this with other edible stuff? What if you forget to take a dose? Take another? Move on to the next one? How much does it cost? Does health insurance cover it? If not, is there a cheaper generic substitute that's available? Number 7. Know when can you live normally again. In the majority of cancer cases, most patients start their normal life activities slowly. How quick they do is totally dependent on them, their physical condition, and the treatment that they were provided. Still, with patience and time, most patients get back to their normal life after treatment. Sometimes the life-saving treatments may cause effects to the patients in ways that they won't go away. For some people, long-term effects mean permanent changes, so they can't go back to the life they used to have before cancer, and grieving about that is normal. Number 6. Prepare for living with it forever. A few times the treatment doesn't end at the expected time. Cancer could become a chronic illness to some, meaning they could live with it forever. You don't really know when it will stop. In these cases, you should turn to your caregiver. Number 5. Decide how much you want to know. Cancer is divided into stages, and the higher the stage, the more difficult the treatments. Even with stage 1 cancer not one as highly threatening as the higher ones, the different treatments are always scary, and surgery is most often regarded with fear. One must decide if he can handle the operation's information or would like their doctor or loved one to handle the affairs. Some use trusted people as proxies, leaning on them to filter out what is needed and what is not fit for the mental health of the patient. Number 4. Accept help. From family to friends, to the doctors and people you trust, support in all its forms is critical for survival. Emotional support is vital for those with cancer, even those who with stage 1 cancer may have reservations on if they can survive. Financial support is very important, as cancer surgery, even in the earlier stages, has complications and insurance is not always guaranteed. Financially, one might be hit pretty badly, making a dent of funds secured for the future, so it's important to have people that can help you out if that happens. Number 3. Don't panic. Cancer at stage 1 isn't so harmful, and there is a big chance that you will recover with surgery without excessive complications. Panic only creates more harm than good and is of no use. Staying calm is important as you're more help to the doctors when you're clear-headed than when you are drowning in your own thoughts. Times are different now, and the quality of modern science and technology has improved vastly, with treatments generally more effective. And stage 1, if it is not spread much, is often curable. Number 2. Keep your questions for the doctor. Treatment, whether you should take it, the types of treatments, your chance of survival, etc., are all questions you should ask your doctor. It helps in forming decisions, knowing the risks, and keeping in mind the financial aspects, and nothing good ever comes out of staying in the dark in situations like these, as even if one passes in the health department, he can be swindled, leaving him healthy but broke, often resulting in unsuccessful suing. Number 1. Think of the present and the future. With stage 1 requiring surgery on a minimum basis and other more advanced treatments if spread, or if the organ that the cancer started in is affected badly, one may have to think about his present state. If he has a job, how many days can he skip? If he has a business, who can he trust to take care of it? If there are any complications resulting from the surgery, what will the future look like? Treatments of cancer usually have side effects, some of which are very painful, so recovery should be kept in mind. I hope you learned a lot from the script and would prescribe this to others also. Don't forget to subscribe to my channel so you never miss our videos. See you in the next video. Thanks for watching the video.